Hello, everyone. Apologies, we're having a bit of a glitch with one of the moderators. I was trying to help her get in. That's why you can't hear. Just give me just a few seconds to see what the problem is. Hey, hi, Natalia. I can see that you're here.
Hi, thank you.
Hi, back over to you.
Thank you, everyone. Sorry for the quick delay. I have some technical issues. My name is Natalia Blanco. I'm an infectious disease epidemiologist with the University of Maryland in Baltimore and in the US. I'm also part of the Inform Africa Research Hub here, part of the DSI Africa. Sophia, do you want to give a quick intro?
Sure. Hello, everyone. Good afternoon from Abuja, Nigeria. My name is Sophia Osawe. I am part of the Inform Africa Research Hub as well with Natalia. Back to you.
Thank you. Okay, so we'll start with today's session. First of all, welcome everyone. Feel free to introduce yourselves in the chat if you like. We'll have two speakers today, about 10 minutes each. And afterwards, we'll have a Q&A. You can ask the speakers any questions. So the first speaker of today is Dr. Andrew Cantor. He's assistant professor of the University, assistant professor of clinical biomedical informatics and clinical epidemiology at Columbia University in the United States. He directs the Columbia International eHealth Lab, and he will be introducing the Observational Health Data Sciences Informatics Initiative.
So Natalia, are you going to run the presentations from your side?
Yes. Wisdom. There you go. Thank you. Okay. Wisdom, do you have them?
Sorry, my apologies. I'm just trying to get this up.
Sure, no problem.
Yeah. Does that play?
It's not.
It's not. It's not playing.
Trying to. Okay, it's about to. So it looks like it's still sharing your screen.
Okay, let me get this through. I'm not sure why it doesn't seem to open.
Let me see if I can share. I can do it
Okay.
from my side, maybe.
All right.
We're not hearing the sound though.
There's no sound.
Natalia, are you able to get the sound through? I can also try sharing it from here.
You're not able to hear it, or yes?
No, we're not hearing it.
Oh, yes. So yes, I don't understand why. So go ahead, please. Thank you.
Let's see. I guess I didn't see the option to make sure that the sound pumps through there. There we go. Good morning, good afternoon, good evening, wherever you are. My name is Dr. Andy Cantor, and I'm director of the Columbia International eHealth Lab, or CL. Assistant professor of clinical biomedical informatics at Columbia University and a former chief medical officer for intelligent medical objects. And I'm going to talk to you today and give you an update on the OHDSI network, the Observational Health, Data Sciences, and Informatics Open Science Network. And if you've seen this presentation before, some of this may be a review, but we're doing some really active, interesting projects under the Africa Working Group in OHDSI that we wanted to make you all aware of. So first of all, OHDSI's mission is to improve health by empowering a community to collaboratively generate the evidence that promotes better health decisions and better care. So OHDSI is actually a tremendously wide distributed network that has grown quite a lot since its original founding in 2013. It started out as the OMOP project, and now has over 4,000 collaborators in 83 different countries. And it's a remarkable community of people working on the open source tools, data modeling, and of course the actual research being produced by the data in OHDSI. The fundamentals of OHDSI are as follows. The data never actually leaves the facilities where it's been created. The idea here is that the source information kept behind a firewall is essentially de-identified and created in a standardized data model called the OMOP Common Data Model, attached to standardized codes that are available through a terminology service. And this allows the individual data sets that are behind individual firewalls to be analyzed using standardized tools, standardized protocols. So the OHDSI network is essentially building out the model on which everyone can standardize their data to, the tooling that helps ETL and ensure the data quality of those ETLs, and that the processes that are actually used for producing the methodological research and generation of clinical evidence are all standardized and created by this, diverse community of over 4,000, probably more than that, people. This allows OHDSI to not only provide a rich database and data network on which to do standardized queries and network studies and create really important evidence like some recent publications around the treatment of hypertension in the Lancet. But there are hundreds of publications that have used the OHDSI network to actually create evidence. The data that's part of the OHDSI network it comes from many different sources. So there's a lot of health record information that gets converted into the common data model. There's claims data, and there's other forms of clinical data, both from survey data as well as other forms of research that get performed. And that information can all be essentially brought into this standardized data model which can then we can be quite confident that that data is appropriately transformed because it's done in a standardized fashion, and that the tools that are actually running to generate open evidence are also transparent, standardized, and you can be confident that their output is correct because you're not creating one-off queries every time. You're running essentially a standardized query that has been approved by the network. The OMOP Common Data Model is well known. It's actually defined as a content public good by Digital Square. It's available in the version 5.4. There are hundreds of different data sources that have been converted to this data model. Majority of them are electronic health records, but a lot of administrative claims data across many different countries. I would say that up to recently, there really was very few data sets that had been converted to the OMOP CDM in Africa, but that has changed. And now there are definitely data sets in South Africa, in Kenya, from the APHRC, Rwanda, and a couple of really interesting ones that I'm going to talk about in a moment, where there's opportunity for national conversion of public health data in African countries into the OMOP data model. So besides the data model itself, the other really important aspect of the OMOP and OHDSI methodology is the use of standardized terminology, because it's not enough to know that a condition is a condition, but I need to know that malaria is actually malaria, or if it's cerebral malaria, it's actually cerebral malaria. And so because the data never leaves the individual facilities where it was created, it's essential that a standardized reference terminology is used to encode that information within the OMOP CDM. As you can see, OHDSI has spent a lot of time to ensure that terminology is actually being used and available to capture that data. So 11.5 billion concepts across 143 different vocabularies. Now, one thing that's unique about OHDSI is that they generally have a standardized concept, and then there are non-standard concepts. So for a given domain, let's say conditions, there is a preferred standard code, perhaps SNOMED, and that there may be multiple ways that OHDSI helps you get from whatever local code system you have, or even non-code system, into the standard codes. So these concept-concept relationships, help you bring in codes from ICD, ICD-10, ICD-11, and other forms of coding systems for conditions to eventually arrive at the standard code, which is SNOMED. Now, one of the challenges has been that for low and middle income countries, do the standardized terminologies like SNOMED, RxNorm, LOINC, and so on contain the appropriate codes necessary to support research and clinical queries from low and middle income countries? And so what the OHDSI network has done, and is that there's 2 releases a year, one in February and one in the fall. And they are in August, sorry. And they have generally updated not only the standard codes that are from SNOMED, ICD-10, and so on, but there's also this community contribution piece. And this is generally where the OHDSI community has identified that there are gaps in terminology. And one of the gaps that we are certainly aware of and have seen that need to be filled is in Africa and other low and middle income countries. And so we have been working with the African working group to actually establish a pathway to bring data and terminology specific from low and middle income countries like Africa, African countries, into OHDSI. And the primary way that we're doing this is through the Columbia International eHealth Labs, CL. You can see the link there on the top or on the bottom, cterminology.org. And this idea is currently a non-standard terminology to map into the standardized codes to help people bring their local data into the standardized codes, but also due to the increased granularity and appropriateness for the low concepts will be elevated or promoted into a standardized concept, and that is one of the main things that we're working on right now. So CL has about, as you can see, about 55,000 different concepts. Originally, they started out from the Millennium Villages project, which was sharing a common dictionary in an open source health information system across 10 countries in sub-Saharan Africa. And now CL has grown tremendously, has had monthly releases for the last 12 years, and has been also named a digital public good and a digital public content good by Digital Square. So the way CL works is that just similar to the OHDSI terminology, as I mentioned earlier, is that out of those 55,000 concepts, each one contains a clinical interface term that is appropriate for use in low and middle income countries. This means that in addition to maybe levels of specificity or diseases and procedures that are performed in Africa, also a lot of the observations that are captured as part of healthcare within these settings or within like DHS surveys. We've ensured that risk factors for HIV or maybe something as simple as, you know, how many nights in the last week did they sleep under a bed net? And these concepts are not present within the standardized terminologies and therefore are a gap within OHDSI. They are in CL, and so this is one of our chances to fill that gap. And the way that CL works is that for every term, there can be one or multiple maps to standardized codes. And this has ensured us, it allowed us to, utilize the CL terminology to not only get to standardized codes, but to function within whatever downstream requirements there are for that health system that's using CL to capture data. This one demonstrates, again, that we've actually included ICD-11 codes, and which is quite remarkable. There's about 20,000 concepts now within CL that are mapped to ICD-11 codes, which is really important for many countries within Africa that have WHO mandated requirements for ICD-11. CL, through its clinical interface terminology and appropriateness for low and middle income countries, has made it kind of the primary shared dictionary within the open medical record system, or open MRS system, which involves open source medical records in 80 countries, and about 22 or more million patients currently use open MRS. This means that OpenMRS is one of the world's leading open source medical record platforms. It actually began in Africa, and as you can see, is used widely throughout Africa. As a matter of fact, many African countries have OpenMRS as their sort of national public health EHRs with national distributions. And this makes it a really excellent source for data and initial research within the OHDSI community, and why we are so eager within Africa Working Group to ensure that OpenMRS, CL, and so on facilitate countries to participate within the OMOP Common Data Model and OHDSI network. And as an example of this, recently we just learned from the Elizabeth Glaser Pediatric AIDS Foundation in Malawi that they've actually taken their national HIV data that was previously stored in a kind of version of OpenMRS, still is, as a matter of fact, and is currently used for much of their PEPFAR and HIV reporting within those countries, where they've actually produced a separate approach where they're actually able to fork the data out of OpenMRS, ETL it into an OMOP data model, and make its content available for analysis using the Atlas toolset. But importantly, be able to participate more widely in network research within the OHDSI community. And so this is kind of the model that we're really working for within the working group. We really appreciate folks who are interested in converting their data or helping us fill the terminology gaps within African contexts. to be used for OHDSI or other downstream use cases to join us and to participate. So thank you again for your attention. If you have more information, you can go to the OHDSI.org website. There's a lot of information available there. And particularly if you want to try out CL terminology or reach out to me, you can do so at the clterminology.org. Thank you.
Thank you, Dr. Cantor. Dr. Cantor will be here for questions at the end. So if you have any questions, save them for the end, or feel free to write it in the chat as well. But stay tuned. The next presentation will be from Anelda van der Walt. She is a dynamic and experienced leader in digital and computational literacy. And she will be presenting or introducing the RSSE Africa, that stands for Research, Software, and Systems and Engineering and Engineers. She won't be able to join today for questions, but Alexandra Palwick will be here to present in representing her. She is a scientific software developer. She holds a PhD in computing from Open University, focused on documentation in scientific software. So we'll go first with the presentation and then again questions. Thank you.
Hello and welcome to today's presentation on the RSSE Africa community. I am going to tell you a little bit about some of the events that we've been running over the past few months and also what is planned for the future. And we hope you will find this relevant and interesting and will join us as well in the community. RSSE Africa is the Research, Software and Systems Engineers of Africa. It's a community of practice that was established in 2019. And this community is really a place where all researchers who code or researchers who find themselves in support roles of research infrastructure, high-performance computing, data, infrastructure, and so on. So this is a place where we share best practices, we learn from each other, we share opportunities, resources, and we generally strengthen the research, software, and systems community in Africa. We also have very close ties to the international research software community and have been collaborating with them for many years. What you can find at the RSSE Africa community is a website. We have some content there talking a little bit about what research software is. There's some links to resources. Then we have a bi-monthly newsletter. The next one will come out in May. We are taking a break in April. It will come out in May. And we look forward to hearing from you, also to share your stories and your information. We also have member spotlights. I'm going to talk a little bit more about that in the next slide. These spotlights are about creating more awareness of the people who write the code and who support the infrastructure, develop the infrastructure, the systems administrators, and so on. And then we also run events. For the community spotlights, we have an online form that people can fill out. It's you can see some of the questions that are being asked in this interview, virtual interview. We ask questions like, can you describe your background and your current role? Describe a typical workday, but specifically expand on the amount of time you spend coding. We want to learn a little bit about your organization, where you get your training and your support, and then also a little bit about how you identify as a researcher, a software engineer, a technician, or something in between maybe. There's increasingly differentiating roles being created in research software and research systems or research digital research infrastructure. And I think it's really important to highlight what the different roles are that are being created, and also what the position, the role titles, the job titles are that people find themselves in when they are doing this work. Then we ask about barriers that you face in your work, We ask about the things that you enjoy most about your work. What do you need to make it easier, and that will support you in your work? What are you looking forward to this year? And career advice that you've received that you would like to pass on to the rest of our community. So you can see it's a very non-academic, easy, friendly interview. And we would love to hear from you if you would like to be featured in upcoming newsletters, but also on the website in general. So at the moment, we've been kind of linking the newsletter and the spotlights. We have one spotlight for every newsletter. Sometimes we have two, but we would love to do many, many, many more spotlights. So if you are interested, please let us know and find the information on the website, and you can let us know, and we will feature you in an upcoming newsletter or on the website. We'd love to hear from you. The newsletter is also available for subscription. You can find that on the website as well. And basically, it's a very simple structure. We have a main feature, so we normally try and write a blog post or invite blog posts from community members. Then we share a few small bits and bytes of community news. We normally go and stalk our community members and find good social media posts that we can include in our newsletter. Mostly that the social medias of events that have been run. That just shows how community members are getting together. We also highlight some events that are upcoming, and the member spotlight is also then featured in the newsletter. We also try and share some useful resources for the community. So we include open access articles, and these are often about research software or research software and systems related topics, either written by African community members or by the international community. So if you have written something about software that you have published or other relevant content that you would like to share, we prefer that it's open access articles so that we make sure that it's accessible to anyone who reads the newsletter. But if you have anything that you would like to share, you're more than welcome also to reach out to us. Then we also include at least one open educational resource, and that is also to encourage people to make use of open educational resources to grow their own skills, but also to share that within their community. So if you have students or junior community members, junior collaborators or employees, these resources that we've collected in our past newsletters, which you can also find online on our website, are generally available and relevant to people who code in research. And then finally, we include a little bit of news from the Research Software Alliance, which is a global organization that specifically looks at policy and funding in research software. So the main focus of today's presentation is really about a recent series that we ran. It was a 6-part series, virtual meetups, and we collaborated for this series with mainly with the Research Software Engineering Association of Asia, but we also had other partners like the African Reproducibility Network and again the Research Software Alliance. The series had 6 episodes, and they all focused on topics related to open science and research software. So we kicked off with a general introduction to a few African researchers who code. Unfortunately, many of those, or unfortunately for us and fortunately for them, many of them have already left the continent and are working in international institutions, but they still have a strong footprint in their original communities and still collaborate strongly. So we had 2 researchers from Africa, 2 researchers from Asia, and that was a very exciting conversation as well, just learning a little bit about their careers, their journeys, and the projects that they are working on. The next episode focused on reproducibility. So how does research code enable reproducibility? Again, a lot of really good conversations. These were all panel format discussions. So very conversational. We had fantastic input from participants also via the chat, the Zoom chat, and just generally had such a great time having these conversations. Loads of fantastic resources which were shared, which I'll also talk about in a moment. Then we had, in December last year, a conversation about how we can make research software open source software. So how we can tie that in with open source best practices. And again, fantastic resources, great speakers, and all those resources are also shared. The first episode for this year focused on documentation. I think it's often a neglected topic when we talk about research software. And here we were talking about documentation not only for people who are generating code that will be used by other people, but also how can you use low-hanging fruit, easy access documentation practices in code that you will be using yourself. I think we've already discovered that often when you are generating code, that you think it will be just for you, and the next thing you know, you're sharing it in your research group, or your supervisor wants to look at it, and then having some documentation available is just great. The fifth episode focused on software testing. Again, we want to make sure that the software that enables our research and that underpins our research really are error-free and does what we think it do. So that's why we included this episode on testing. And finally, in March, we had a great conversation with some research software funders, and again, looking at policy and just really some great conversations to understand what the software funding landscape looks like, some resources that were shared. All these episodes have been recorded except for the last one. I made a mistake and I didn't record it, and I don't know how I can apologize to the community. But these resources are all available on the website. So the recordings, a summary blog post, and the resources that were shared during the talks by the participants and the speakers are all available online on this meetups, community meetups page that I have linked here. The great thing about this meeting was that these meetings were that we had over 650 registrations for the 6 events, with 400 unique registrations and 28 African countries represented, with over 70% of the registrations coming from Africa. So we can see that research software really is a topic close to the heart of our African researchers. And we are looking forward to, I wanted to say, here's just some one-word feedback that they gave about their experience of the workshop series. You can see people thought it was engaging, empowering, informative. And we are looking forward to running another series quite soon. So if you are interested to be notified of upcoming episode seasons in this series, please feel free to click on this link, go to the QR code, and sign up to be notified. You only have to submit your email address, and we will then make sure that you receive information about upcoming episodes in this series. Thank you very much for your time. We look forward to engaging with you, and we look forward to also learning more about your own work. Remember to sign up for the community spotlights and also the newsletter. Thanks so much.
Thank you, Nelda. Sophia?
Great. So yes, thank you for the 2 presentations. They were really great and very engaging, even though they were live. Great. So we've concluded with the 2 presentations, which means we'll have a bit more time to get some questions. I haven't seen any questions in the chat, so please, if you do have a question, raise your hand. So we have Andrew Amelia guessing, and Alexandra. So please, the floor is open for any questions. Kindly raise your hand. We will spot you immediately. Yeah. I'm not seeing any questions. Any hands? Okay. Okay. Go ahead, please, Bubakar.
Hi, Sophia. How are you?
Hi, nice to see you again.
I say good. Wonderful presentations, Andrew. I was just curious. We are here at MRC and we are mostly doing research. I'm not sure if we want to adapt the Odyssey, it will be very useful. There might be a lot of extra stuff that we don't need, given that we are not a clinical facility. What do you think?
So OHDSI is primarily a research organization. It is observational research. There is quite a lot of work being done in specific verticals. So, for example, oncology that requires information that's really non-clinical, a lot of registry type information. There's a lot of public health information that APHRC with DHSS surveys that are incorporated. So there are some limitations to the model in the sense that it is a person-centric model. So if your data is not person-centric, it takes a little bit of work to try to move it into this clinical or sort of common data model. Certainly things like specimens or something that's broader than an individual person, like a household. But there are solutions for those kinds of things too. So one of the biggest challenges, I think, of non-clinical research might be within the terminology mapping, because it is necessary to include a standardized map in addition to the CDM. And so that might be a place where there are gaps. But you can actually go onto the athena.odyssey.org website and actually do some searches to see whether your concepts might be there already. I'll put that in the chat. But it's certainly focused on research. That is the primary goal. The expansion to include more clinical medicine and public health through operational data, like in Malawi and other countries, it has been a specific direction that the Africa Working Group is trying to take it, because we feel like there's a benefit to sharing the infrastructure. Countries are required now to build out their own health information infrastructure, and so the more that they can benefit from that, from local use cases as well as the research use case, the more they're able to sort of leverage the investment that they're making in the technology.
I see.
I don't know if that did answer your question.
I thought it was more on the clinical, so it's more research. Yeah, we do have an IDSS, and we've been discussing about OMOP, and you think I still struggle to distinguish between OMOP and Odyssey. What's the difference? One the subset of the other? Or?
Well, so OMOP was the original project that created the data model, and it's the OMOP common data model, but the network of the open science, open source network is called OHDSI. So that's the new version of OMOP, essentially.
I see. Cool. Thanks. That's clear.
And the terminology services, I put a link in the chat.
Okay, we'll take a look.
Thank you. And thank you for dropping the links, Andrew. This is out of curiosity before the next question comes in. The names, is there someone that really likes Greek mythology? Because the names are really linked to the gods and goddesses.
Yes, that was, I think, a very strategic play in naming benches. So all of the tools have a Greek, except for White Rabbit and things like that. But otherwise, they're very much Greek inspired.
Interesting. Any other questions? The floor is still open for questions. And while people are thinking of the questions, Alexandra was wondering, because you do a lot of this series, capacity building trainings, are you having any affiliations with any African universities, or are there plans for that?
So I can thank you very much for the question. I can say that a lot of work that Anelda has been doing. So I have been working with Anelda for a few months, and a few years ago I also worked with her for a little bit. And yes, almost all work that Talarify and Anelda has been doing is connected with multiple universities, dominantly in South Africa, ranging from University of Cape Town, Pretoria, but also I did a bit of work with Anelda in Mafeking in Northwest University. So it spans across pretty much all, if not most, most, if not all, higher education organizations in South Africa, plus also consortia. So some of the work that we've been doing very recently, where we definitely can identify research software and systems engineers, and we would like to bring them into this community of practice, is with the diplomics. So the omics, this is a project, a consortium between several research organizations in South Africa, bringing together omics researchers. Again, we ran a couple of workshops with them recently, the participants, and so some of them who are the research software engineers come from a number of universities in South Africa.
Fantastic. Great work, both. Not seeing any. Oh, perfect. Emily, please go ahead. Oh, probably not Emily. Emile? So you're muted. We can't hear you. Yes, please unmute.
Can you hear me now? Yeah, thanks
Hello,
very
please
much.
go ahead.
Yeah, so I have a question for the Diplomic, which is actually a great initiative in Africa for omics. I think multi-omics. I would like to know how much of multi-omics data that has been generated or roughly or even shared to be fairly shared. And also, is the platform actually what, because we'll be talking about software for a platform for a multi-omics data integrations, a kind of African-specific software or tool for multi-omics data integrations, or that may be integrated a different modality data for clinical multi-omics, etc., to learn more about biological signature or biomarkers, something like that. Over to you. Just a bit from Diplomic to hear what's going on there. Yeah.
Thank you. I can't quite answer these questions because we are not a part of the Diplomics. We have done some workshops for Diplomics and hopefully will do and support their community of practice in terms of their digital skills development. However, when it comes to the solutions for the omics data and the software that Diplomics is building, that I can't answer because we're not part of that work. So the workshops I just mentioned, the very recent ones, we run the Open Science, Introduction to Open Science, extended with some hands-on components for the omics members of the omics community and Diplomics. So we equip people with skills and capabilities, and we may introduce them to tools that are already available for them. But yeah, in terms of the actual solutions for the data that Diplomics is planning, we are not part of that. So sorry, I cannot answer. I cannot answer that in detail. However, I would, my interactions with Diplomics they are very open to questions and suggestions, and they're still a growing community. So reaching out to them directly is probably the best option.
Okay. Thank you for the question and the answer, Alexandra. Any other questions? I know we have about 15 minutes. Roughly, right, Natalia?
I think we have about 4.
Oh,
as you just
4,
said.
really?
Yeah.
Okay.
Yeah, it looks
Okay.
like it. I don't know why we see 11 in the top, but he just sent a text.
Exactly.
It's only 4.
Okay. Okay. Good. So we do have time for one more question or comments. It can be a comment, doesn't have to be a question. It can be you're excited about this session. Okay. Amelia, please go ahead.
Hi, yes. Of course, I am excited about these sessions, and thank you for the presentations. I just wanted to ask the RSSE Africa, so I'm a member and I have attended some of the meetings. I just wanted to ask you, how do you feel this area, so research, software engineering for research, is going to maybe pick up in Africa? Because it's quite a new concept. I mean, definitely when I explain this to some colleagues, and we have a small lab at MUBAS where we do actually develop some software for research, and OHDSI is in a way software for research, right? Because it enables you to conduct research. How do we, where do you feel the understanding is of the researchers in Africa about these things, and how do you feel they engage with this kind of software, including open source? Yeah.
That is an excellent question. And in fact, we are we put together a proposal, let's call it a proposal, and are drafting some more proposals or projects, or just basically trying to get it off the ground to research this landscape in the African continent. Based on the interactions that we've had for RSSE Africa, events and working with the community, we think we can say that research software engineering exists in the African continent, that actually there is a lot of research software engineers and many projects developing software for science, code for science. But perhaps even as you point out, many of those RSEs in Africa don't see themselves as research software engineers. Perhaps they don't perceive this as work, software engineering for science. And I think that's why we want to gain better understanding how that landscape looks, how people see themselves, how they see their projects. One good indication is, so RSE, Research Software Engineering, that is an international movement, and there has been surveys run almost annually in different regions. And now we know from our meetups, there are at least dozens of research software engineers in Africa, but the survey on the African continent received, just off the top of my head, 3 or 4 responses, maybe a few more, but literally a handful. And we think this is because there is a mismatch in terminology, there is a mismatch in understanding. And so we would love to research this landscape. We currently need funding to research the landscape. So yeah, that's the call out from us. We would love to collaborate with partners that want to know how the landscape looks.
Awesome. Thank you, Alexandra, and thank you to both speakers. Thank you for the interactions. We have come to the end of this session. So we'll join back the main group. Take care, everyone. Thank you.
Bye. Thank you.